Which functional deficit would be observed if this nerve was lesioned? Gabby here from Med School Bootcamp, and here we're looking at a dissection along the posterior aspects of the pharynx. This is a very complicated area, and there are a ton of nerves and cranial nerves that are emerging from this area, as we can see over here. So let's zoom in here a little bit and identify some of the nerves that are found. Moving from medial to lateral, here we're going to find the sympathetic trunk or the sympathetic chain. We could see right over here the superior cervical ganglion. If we move more laterally to the sympathetic chain is where we're going to find the glossopharyngeal nerve. Lateral to the glossopharyngeal nerve, we can see the vagus nerve as it descends and will travel in the carotid sheath between the common carotid artery and the internal jugular vein. Lateral to the vagus nerve here is where we're going to find the hypoglossal nerve. And the hypoglossal nerve, we know, is the nerve that provides motor innervation to most of the extrinsic and intrinsic muscles of the tongue. So that being said, if we had a lesion along the hypoglossal nerve, it is likely that we will have the inability to move the tongue. Now, looking at our answer options here, we need to narrow down which one of these muscles is not innervated by the hypoglossal nerve. The genioglossus, the hyoglossus, and the styloglossus all receive innervation from that hypoglossal nerve. The palatoglossus, however, because it's associated with the hard palate, it is going to receive innervation from the vagus nerve. So that being said, if the hypoglossal nerve was lesioned, we would then have the inability to move the tongue. However, palatoglossus will still be able to function because it receives different innervation from the vagus nerve. Let's check our answer here. So C is the correct answer.